The Ontario government is saying that it is making easier and more convenient for people to connect to care by expanding the role of registered nurses to prescribe medications after meeting specific requirements for certain conditions. Let's listen to what Deputy Premier and Minister of Health Sylvia Jones said.
With our plan, we saw a record-breaking year with over 15,000 new nurses registered to work in Ontario, with another 30,000 nursing students currently studying at Ontario colleges and universities. To support nurses currently in the profession, our government has invested $14 million to support 600 nurses to upskill their training to work in critical areas of hospitals. And earlier this summer, we announced the Clinical Preceptor Program that pairs experienced frontline nurses with new grads, internationally educated nurses, or those looking to upskill and ensure they have the support they need. Today, as part of our Your Health Plan, I am pleased to announce that our government is taking another step to make it easier and more convenient to connect people to the care they need by expanding the role of registered nurses to prescribe medications for certain conditions in a variety of convenient settings in your community. With these changes, registered nurses that complete additional training will be able to independently provide people with birth control, drugs for smoking cessation, travel medications to treat and prevent diseases like malaria, topical wound care, and vaccinations such as the flu shot and COVID-19 vaccine.
Starting in January 2024, registration is expected to open for registered nurses interested in completing the additional education requirements to work more independently in their community settings. As more registered nurses complete the training, more people will have faster access to birth control, drugs for smoking cessation, and travel medications to treat and prevent malaria and travelers' diarrhea. This move, the province said, will provide doctors and nurse practitioners with more time to treat patients with more complex needs. In a written statement, Sylvie Crawford, the Executive Director and CEO of the College of Nurses of Ontario, CNO, said, "We are collaborating with health system partners and creating the standards that promote safe nursing practice. This includes ensuring changes in nurses' scope of practice, including RN prescribing, are implemented safely for all Ontarians. The training programs will be offered through select colleges and universities," the province confirmed. This development comes after the province expanded the prescribing powers of pharmacists in Ontario earlier this year. Pharmacists are now permitted to prescribe medications and treat common ailments including urinary tract infections, pink eye, and cold sores. The Ministry of Health said last month that 89% of pharmacists in Ontario have opted to participate, with pharmacists now able to treat 22 common ailments. IPTV.